Hi, my name is Emily Smith. I'm going to be doing my head-to-toe assessment. Here is my blank pages. Okay, and I'm going to begin my assessment. Okay, knock, knock, knock.
Hello.
Hello, my name is Emily Smith. I'm a nursing student with Saginaw Valley State University. Can I get your name and date of birth?
My name is Adam Wells, and my date of birth is 7/21/05.
Great. And where are we right now?
We're at Campus Village today.
Okay, very good. And what is the year?
That's 2025.
Okay, very good. And who is our president?
Donald Trump.
Very good. So my patient is ANO ×3, so I feel comfortable moving on to the next part of this assessment. So before we begin, I'm just going to let you know that we're going to be doing a head-to-toe assessment today, which is just making sure that everything is functioning as normal from your head to your toes.
Okay.
Before we begin the assessment, I'm just going to ask some important questions. If you feel uncomfortable, I do just want to let you know that all this information will stay between you and I in this room.
Okay.
It is confidential, and just answer all the questions honestly.
Okay.
Okay?
Yep.
So to begin, do you have any diagnoses that I should be concerned about?
No, ma'am.
No?
Other.
Okay. No past diagnoses?
Correct.
Okay. Any medical history that I should be concerned about? Family history?
I had some heart problems on my dad's side, and some strokes on my mom's side, but other than that, no.
Not much?
No.
Okay. How about allergies?
No allergies.
No allergies?
Nothing.
Nothing to food or medications?
Nope. No
Okay.
food or med allergies.
On current medications
No,
right
ma'am.
now?
No meds.
No.
Taking no meds.
Okay. How about any supplements or herbs or over-the-counter medications?
Multivitamin every other day.
Okay,
When
good.
I can.
Okay.
No.
Any over-the-counter meds?
Ibuprofen and Tylenol for my aches and pains.
Okay.
So.
Okay, very good. And then any previous surgical procedures or hospital stays?
I had my wisdom teeth out, but no
Okay.
no major surgeries or
Okay.
hospital stays.
And no issues with your wisdom teeth?
No.
Or anything
Yep.
like
Healed
that?
good.
Okay, very good. I'm going to ask some lifestyle questions.
Okay.
How do you feel your diet is?
Diet is pretty good. I try to stay away from fatty foods, sugary foods, but I don't
Okay,
really
good.
follow specific.
Okay. Eating 2 to 3 meals a day?
Yes, ma'am.
Feeling full?
Yep. Oh, yeah.
Okay. How about your physical activity?
I try to exercise every day, but it's like every other day. Just
Okay.
busy. Always on my feet.
Very good. And what type of exercises do you do?
Weightlift, run,
Okay.
play a little soccer.
Very good.
Mhm.
Okay. These next questions may be a little uncomfortable, but like I said, just answer them honestly.
Okay.
Do you drink any alcohol or do any smoking?
No, ma'am.
No? No vapes?
Nope.
Okay. All right. No marijuana?
Mm-mm.
Okay. How about illicit drug use?
No, ma'am.
No?
Mm-mm.
Okay. Very good. All right. And then, are you in any pain right now?
Ma'am.
No? No pain at all?
Mm-mm.
All right. Very good. So I feel comfortable moving on to the next part of my assessment.
Okay.
Before I do that, as far as incontinence, do you feel like you are able to make it to the bathroom on time?
Yeah.
You're not wetting your bed or anything like that?
Nope.
And you feel you're able to do your day-to-day activities?
Yeah, I got no
like
problems.
dressing yourself and anything
No
like
problems.
that? Okay, very good. Okay, so to begin, I'm going to start with a set of vitals.
Okay.
As far as blood pressure, do you have a preference?
Oh, we can do this right arm.
Okay, perfect. Very good.
Yeah, my blood pressure is usually typically normal.
Typically normal? Doesn't run high or low or anything?
Mm-mm.
Okay, perfect. Okay, I'm going to first find the brachial pulse. Okay, feel your brachial pulse. Very strong, bounding. Go ahead and just breathe normally for this, okay? Okay. Good. So I got 122/82,
Okay.
which is a normal blood pressure range. I'm not concerned with hypertension or anything like that. Okay. Next, I'm going to put this pulse oximeter on your finger, and this is just going to test your oxygen saturation. Before that, let me just assess your fingernails real quick for any clubbing. They look good. If I did see any clubbing, I would be concerned about hypoxia or oxygen saturation, but I don't see anything like that.
Okay.
Okay. So I'm gonna get your pulse and your SpO2 real quick. Good. Okay, your pulse is 52 and your SpO2 is 97. So those are both within normal ranges. I would expect your oxygen to be 95 to 100 and your pulse from 60 to 100.
Okay.
So you have a very good pulse.
Good.
Low pulse probably means you work out. Okay, so next I am going to feel for your radial pulses. And this is, I'm just going to be getting another pulse just to confirm that that pulse I just took is accurate. Good, so both pulses are very strong, symmetrical. I'm going to feel both of your brachial pulses real quick. Okay. Okay, great. Those are both strong and symmetrical. So next I'm going to get a radial pulse and do this for a full minute. And I'm also going to note your respirations while I do this. Okay, so for your radial pulse, I got 56, which is accurate with the pulse ox that we also just took. So I have no other concerns with that. If I had a temperature probe, I would test your temperature, but because I don't, I'm just going to feel your skin, if that's okay. Okay, so your skin is warm, it's not overly hot, not cold, so I would assume that your temperature is within normal range, which would be like 98.6. Okay?
Yep.
So I feel comfortable moving on to the next part of my exam, which is assessing the arms. Is it okay if I roll up your sleeves? Okay. Okay. Before I begin assessing your arms, have you had any surgeries on your arms? Any broken bones?
I broke my wrist, but no.
Okay,
No
and
surgeries.
that healed properly?
Yes, ma'am.
Okay, great. So I'm just going to go down your arms, looking throughout your arms for any moles, any lesions, scrapes, bruises. They all look pretty good, just a few freckles, some acne. Is that normal for you? Okay, very good. I'm going to go and touch your arms, noting muscle symmetry and muscle strength, muscle tone. Is there any tenderness while I do this?
No.
Okay, great. Very good. So I'm going to test some range of motion next, okay? So I'm just going to place my hands on your shoulders. Can you do some swimming motions forward for me? Okay, good. And your other arm? Great. A little bit of cracking, is that normal for you? Yeah, okay. Probably comes along with playing sports.
Yeah.
Okay, great. And can you do it backwards for me also, as well? Good. And good. Okay. And then I'm going to feel your elbows. Can you just do some pulling in with your arms? Good. Good. No creak or cracking there. And can you do it with your wrists? Good. No cracking either. Okay, very good. So your range of motion all seems pretty good. I'm going to test your strength next. First, can I have you press against my fingers? Good. Okay. Good strength in your hands. And then I'm going to pull back, don't let me. And then I'm going to push. Good. And then I'm going to have you have your hands like this. Don't let me push in. Good. opposite, only push. Good. And then put your arms like this, don't let me push down, and don't let me push up. Good. Okay, so your strength in your arms is good, your range of motion is good. I didn't know any abnormalities with that.
Okay.
Before I move on, I'm going to test cranial nerve number 11,
Okay.
which is your accessory spinal nerve.
Okay.
I'm just going to place my hands on your shoulders.
Okay.
Go ahead and just shrug up for me. Good. One more time. And then turn your head side to side. Good. Good. So your accessory nerve number 11 is good.
Okay.
Okay. So I feel comfortable moving on to the next part of the exam. Okay. And then before I move on to the head, let me just check your fingers real quick for proper cap refill. It should be within 3 seconds in all of your fingers. Good. And then your other hand. Good. So if it was over 3 seconds, I would be concerned about perfusion issues.
Okay.
But because it's under 3 seconds, I have no further concerns with that.
Okay.
Okay. So I'm going to move on to the next part of the assessment, which is your head.
Okay.
Before I start this, is it okay if I touch your head and your hair?
Go for it.
Okay. I'm just looking through your hair, noting any dryness. Do you have any skin conditions that I should be concerned about?
I just acne.
Okay, and do you
Dry
see
skin.
a dermatologist
Yes,
frequently
ma'am.
for that?
Yes, ma'am.
Very good. So I didn't notice any moles, no lesions, no masses, no bumps or bruises or anything like that. So that looks pretty good to me. Okay, so next thing I'm going to do is I'm going to feel both of your sinuses.
Okay.
I'm going to start with your frontal sinus.
Okay.
Is there any tenderness here when I do this?
No.
No? And how about your maxillary?
No.
No? Okay. So your frontal and your maxillary sinuses look good. There's
Okay.
no tenderness with either of those.
Okay.
Do you get normal sinus infections or anything like that?
No, ma'am.
No, nothing like that?
Nope.
Okay, very good.
Mm-mm.
Good. And while I'm here, I'm going to palpate all of your lymph nodes.
Okay.
Okay, so I'm going to start on your head. Is there any pain or tenderness while I do this?
No.
Okay, so I'm going to palpate your occipital lymph node.
Okay.
Any pain or tenderness?
No.
Okay. Your pre-auricular lymph node?
No.
Any pain? Your post-auricular lymph node?
No.
Any pain? Good. Go ahead and look up for me. Your submandibular lymph node? Any pain?
Nope.
Submental lymph node? Any
Mm-mm.
pain?
Nope.
Good. And then your cervical chain?
Okay.
Any pain or tenderness?
No.
Good. So can you go ahead and roll your shoulders forward for me? Very good. I'm going to feel for your supraclavicular lymph nodes.
Okay.
Any pain or tenderness?
Nope.
No. Very good. Okay, and while I'm here, I'm going to check this one. Any pain or tenderness?
No.
While I'm here, I'm going to assess your skin turgor,
Okay.
which is just making sure you're properly hydrated.
All right.
It should fall back in place instantly, and it does.
Okay.
Very good. No tenting. If I did see tenting, I would be concerned about dehydration.
Okay.
But I don't see anything
Alright.
like that.
Sounds good.
Okay, very good. And while I'm at your head, I'm going to assess cranial nerve number 5,
Okay.
which is trigeminal.
Okay.
And I'm going just to grab my pen light here. I'm going to have you close your eyes, and I'm just checking for sensory throughout your whole face. I'm going to press different points. Just tell me where I am on your face.
Forehead.
Good.
Left cheek.
Good.
Right cheek. Nose. Chin. Forehead.
Very good. Okay.
Alright.
So your cranial nerve number 5, trigeminal, is
Okay.
intact and functioning as normally.
All right.
So I have no concerns with that.
Okay.
The next cranial nerve I'm going to test is cranial nerve number 7, which is your facial cranial nerve. And for this, I'm just going to have you do some expressions. for me,
Okay.
Some facial expressions.
Sure.
Can you smile, frown, puff your cheeks, and raise your eyebrows? Very good. Okay. So your cranial nerve number 7 is intact and functioning well.
All
So I
right.
have no other concerns with that.
Very good.
So I'm going to move on to your ears now.
Okay.
But before I do this, I'm going to test your cerebellar function.
Sure.
Okay? And that's just making sure your coordination is all functioning
Okay,
as normal.
All right. Yeah.
Okay, so first I want you to place your hands like this, up, and I'm going to have you press your pinky to your thumb and then every finger after that. Yep, and just do it as fast as you can for me, back and forth. Very good. Okay, that's as normal. Now I'm going to take my pen light here,
Mm-hmm.
and I want you to touch your nose, and now touch my pen light, and I'm going to move it around and do the same thing. Good. Good. One more time. Very good. Okay. Very good. And the last test I'm going to have you do is I'm going to put your hands on your lap here. Good. And I want you to flip them over and flip them back and do that as fast as you can. Very good. Okay. So I see no other issues with your cerebellar function. Okay.
Good.
So it all seems to be intact.
All right.
Now I'm going to move on to your ears.
Okay.
Before I do this, have you had any procedures with your ears, like tubes? Do you get
good.
recurrent ear infections?
Nope.
Nothing like that? Okay, great. Okay, so good. I'm just going to take a look at the ears. I'm going to palpate the pinna. Is there any pain or tenderness while I do this?
No.
Very good. I don't see any inflammation or anything like that.
Okay.
I'm going to look inside your ears if that's okay. I'm going to pull back and up on the pinna, just looking inside. I don't see any abnormal wax or any constriction or blockages or anything of that sort. Looking in this ear too. Very good. No blockage, no excessive earwax.
Okay.
Okay. And as far as hearing, have you ever had hearing loss?
No, not
Never
really.
told you've had hearing loss?
No, ma'am.
Okay, so because you say you've had no hearing loss and we're having a conversation, I would assume that cranial nerve number 8 acoustic is intact and functioning as normally, but we'll assess that further later.
Okay.
Okay. So now I'm going to move on to the eyes.
Okay.
So looking at your eyes, they look symmetrical to me. I don't see any abnormal drainage or anything, no yellow or green goopiness, which would be a sign of infection. They'll look normal there. I'm going to touch your eyelids if that's okay.
Yep.
Okay, I'm going to pull up on them. Can you just look down for me? Very good. I'm going to pull down, and can you look up? Good. So your sclera is white and your conjunctiva is pink. So I have no concerns about infection or jaundice.
Okay.
Okay. So I'm going to assess some cranial nerves here and just assess some of your eye functions.
Okay.
Okay, so to begin with, I'm going to test cranial nerve number 3, which is ocular motor.
Okay.
And I'm going to do this first by making sure that your corneal reflex is intact and working well. And I see reflectiveness in both eyes. Go ahead and just look at me. I'm going to shine a light up. Good. So both eyes are reflective. Now I'm going to see if they both constrict. Go ahead and just continue looking at me. I'm going to shine a light in both eyes again. Good. That one constricts. And good. They both constrict.
Okay.
Okay, and so I am testing per level I'm doing this, which means your eyes are equal, round, reactive, and accommodating to light. Now I'm going to test for accommodation with both of your eyes.
Okay.
I'm going to have my hand here and my pen light up here. Go ahead and just start looking at my hand. Now look at my pen light, my hand, and then my pen light again. Very good. So I can say your eyes are accommodating. So I would say that your eyes are perla, which is, again, equal, round, reactive, and accommodating.
Okay.
So cranial nerve number 3 is intact and functioning.
Okay.
Now I'm going to assess cranial nerve number 4 and 6, your trochlear and abducens.
Okay.
And I'm going to do this by the 6 cardinal fields of gaze.
Okay.
Okay, so it's just a test functioning those cranial nerves again.
Okay, sounds good.
Go ahead and follow my pen light in 6 different directions, not moving your head, just following the pen light. Good. Okay, so I can say cranial nerve number 4 and 6 are intact and functioning.
Okay.
Okay.
Sounds good.
So I think that is it with your eyes. I don't think I have any other questions.
Okay.
I'm going to now move on to your nose.
All right.
So before I begin this, do you have any issues with your nose that I should be concerned about?
Smell good, no blockage, no nothing, not much allergies.
No procedures on your nose of any sort?
This cannon works.
Okay, very good. I'm going to test cranial nerve number 1, which is olfactory.
Okay.
And by doing this, I'm going to have you close your eyes and
Okay.
smell something that I grab. Okay? So keep those eyes closed. I'm going to put this under your nose. Good. And what do you smell?
Smell coffee.
Very good. Okay.
Yeah.
So cranial nerve number 1 is intact and functioning, I can say.
Okay.
Okay, now I'm going to have you close one side of your nostril and breathe in one side. And now do the other. Very good. Okay. So everything seems normal there. I'm going to shine a light up your nose next and
Okay.
just go ahead and take a look in your nose and
Okay.
make sure everything is functioning well.
Sounds good.
Okay, go ahead and look up for me. Good. Mucous membranes look moist. I don't see any polyps or deviated septums. Very good.
All right.
Okay, so I have no concerns with your nose.
All righty.
Okay, now I'm going to move on to your mouth.
Okay.
Looking at your mouth and your lips, I see normal lip color. I don't see any dryness of any sort. I assume you use chapstick when
Yep.
your lips get dry.
Yep.
Okay, go ahead and just say ah for me and open your mouth. Very good. I don't see any enlargement of the tonsils.
Okay.
Your mucous membranes look moist.
Okay.
Nothing looks abnormal there. I didn't see any cavities of any sort. No
Okay.
missing teeth.
Good.
It all looked good in there. You go ahead and stick your tongue out for me and move it side to side. Very good. So I can say cranial nerve number 12 is intact and functioning.
Okay.
Okay. And that's your hypoglossal.
Okay.
And can you say one more time
Yeah,
just
sure.
for me?
Good.
So, cranial nerve number 9 and 10
Okay.
are functioning.
Good. All right. Good.
And cranial nerve number 9 and 10 are your vagus
Okay.
and your glossopharyngeal.
All right.
So I can say that both of those cranial nerves are intact and working.
Okay.
Okay?
Yes.
Okay, good. So
Alrighty.
now I'm going to move on to the neck part of this exam.
Okay.
Can you go ahead and just look up for me?
Sure.
Very good. I'm noting symmetry throughout your neck. Good. Good. And I'm going to just touch your neck here, if that's okay.
Sure.
Good. And your trachea seems to be in line. So
Okay.
I don't see any abnormalities of that sort.
Okay.
The next thing I'm going to do on your neck is going to palpate both of your carotid arteries.
Okay.
And then I'm going to take a listen.
Okay.
And when I'm listening, I'm just listening for any bruise of
Okay.
any sort. And that would indicate like a blockage in your artery.
Okay.
That would make me believe that there's atherosclerosis, which could lead to a heart attack. So that wouldn't be very good.
Okay.
Okay?
Yeah, sure.
So I'm going to go ahead and palpate both of your carotid arteries one at a time though. Good. Strong and bounding. I'm going to check the other one. Good. Strong and bounding.
Good.
Okay.
All right.
Now I'm going to take a listen. I'm going to auscultate both carotid arteries.
Okay.
One at a time. And I'm going to do this with the bow side of my stethoscope. Again,
Okay.
listening for bruise.
All right.
Okay?
Sounds good.
Go ahead and just look up for me. And take a deep breath and hold it. Good. No whooshing sound, which would indicate bruise. Good. Again, no whooshing sound.
Awesome.
So I don't believe that you have any bruise.
Very good.
Okay, very good.
All right.
All right, so now I feel comfortable moving to the back side of you to do my
Okay.
respiratory exam.
All right.
Before I do that, do you have any other questions?
No.
No, not so far. Okay,
Mm-mm.
very good. So I'm going to have you turn around and face the wall for me.
Oops, sorry.
Good. Is it okay if I untie the back of your gown?
Sure.
Okay, very good. Okay. I'm going to place my hands on either side of your neck. I'm not choking you. I'm just going to see if your thyroid, everything is looking good with your thyroid, and it should be non-palpable.
Okay.
Okay?
Yep.
So I'm going to move your trachea to the left. Go ahead and swallow. Good. And now I'm going to displace it to the right. Go ahead and swallow. Good. So I didn't feel your thyroid, so I have no concerns with that.
Okay.
Now I'm going to move on to the respiratory part of this exam.
Okay.
Okay, so during this, I'm going to be listening to 12 spots on your back,
Okay.
and I'm going to be having you take a deep breath every time I listen for a new spot. If you feel lightheaded or anything throughout the exam or just need a break, go ahead and raise that left hand for me, and we'll take a break, and we'll go from there.
All right.
Okay.
Sounds good.
Very good. Before I do this, I'm just going to look at your back real quick.
Sure. Before.
Your spine all looks good. It doesn't look, no curvature or anything noted. You do have a few spots of acne and freckles on your back, but you said that was normal.
Yeah, it's normal for
Good.
me.
And you
Yeah.
have no back problems or anything of
No,
that sort. Very good. Okay.
Good back.
And can you sit up for me? Good. And I'm going to place my hands here just to find where the end of your lungs are. Can you go ahead and take a deep breath? Good. One more. And one more. Good. So I'd assume that your lungs end right about here, okay? And can you roll your shoulders back for me? Good. And your clavicle's about here, so this is where I'm going to start and end for your assessment. I'm next going to just check your anterior to posterior ratio of your chest to back. So I'm just going to feel between your sternum and your back. Good. And then the sides here. Good. So I'm noting a 2-to-1 ratio, which is normal.
Okay.
If you had a 1-to-1 ratio, I would be concerned about COPD or overuse of the accessory muscles, but I'm not noticing anything like that.
Okay.
Okay?
Yes.
Good. Okay, so now I'm going to listen in 12 spots. I'm going to be using my diaphragm on my stethoscope for this. Okay. Go ahead and take a deep breath. Good. Deep breath. Good. Deep breath. Deep breath. Deep breath. Good. Deep breath. About halfway there. You still doing good?
Yep.
Good. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. And last one, deep breath. Good. So I'm noting clear sounds throughout your lungs.
Okay.
I would be concerned if I heard crackles or wheezing of any sort, but I didn't, so I have no concerns about that.
All right.
Okay. So next I'm going to percuss those same 12 spots on your back. This shouldn't hurt, but if you do feel any pain or tenderness, please let me know.
Okay. Sounds
you can
good.
go ahead and breathe normally throughout this. Good. So I heard resonance throughout your lungs, no dullness of any sort, which would indicate fluid.
Okay.
But because I didn't hear that, I have no other concerns with your respiratory findings.
Okay.
Okay?
Yep.
So I'm just going to cover you back up here.
Okay.
I'm going to have you lay down in the bed
Okay.
with your back down. Good. Your chest facing up. Very good. And you can go ahead and cover up under these sheets. Great. Okay, first I'm going to assess for any JVD,
Okay.
which is jugular vein distension. Can you go ahead and turn your head to that side? Good. And face towards me. Turn your head this way. Good. So I'm not noting any JVD, which would lead me to believe that you have increased venous pressure,
Okay.
but I'm not seeing anything like that. If I did notice it, I would raise the head of the bed to at least 45 degrees
Okay.
and note it again, but I'm not seeing anything of that sort, so I don't have any concerns.
Okay.
Okay, so
Sounds good.
now I'm going to move on to the cardiac portion of this exam.
Okay.
Can I uncover your chest here?
Yeah.
Great.
Oh, I got it.
Thank you.
Just give me a second.
You're good. Okay. So looking at your chest, everything looks symmetrical. I don't see abnormal masses or anything of that sort. Do you have any heart issues that I should be concerned about?
No heart problems.
No, never seen a cardiologist for anything?
No.
Okay. And doctors never told you you had a murmur of any sort?
No, ma'am.
Okay, very good. So I'm going to move on to my cardiac portion of this exam.
Okay.
And I'm going to be listening to 5 different spots on your heart.
Okay.
Just listening to the valves for normal S1, S2 notes and murmurs, okay? So I'm going to start on the right side of your chest.
Mm-hmm.
And I'm going to use my diaphragm. I see your clavicle here of the patient, so I'm going to go to the second intercostal space. So clavicle, space, rib 1, space, rib 2, space.
Okay.
Okay, so I'm going to be listening with my diaphragm to the aortic valve. Okay?
Sounds good.
Good. Normal S1, S2 sounds. I'm going to flip my stethoscope to the bell and listen for any murmurs. Good. So I don't hear any swooshing sound, which would indicate a murmur.
Okay.
Okay. So now I'm going to move to the left side of your chest, okay? And I'm going to again find the second intercostal space.
Okay.
So I see your clavicle here. First space, rib 1, space, rib 2, and space. So now I'm going to listen to your pulmonic artery, okay, with my diaphragm first. Good. Normal S1, S2. Now I'm going to flip my stethoscope and listen for any murmurs. Good. Now I'm going to move to the third intercostal space and listen to Erb's point. Okay? So, second intercostal space, rib 3, third intercostal space. Okay. I'm going to listen to my diaphragm right here. Good. Normal S1, S2. I'm flipping my stethoscope to the bell, listening for murmurs again. Great. No murmurs heard, no swooshing. Now I'm going to move to the fourth intercostal space.
Okay.
So that was intercostal space 3,
Mm-hmm.
rib 4, and intercostal space 4.
Okay.
And this is going to be your tricuspid valve. Okay?
Mm-hmm.
Good. Normal S1, S2 heard.
Mm-hmm.
Now I'm going to flip my stethoscope to the bell
Mm-hmm.
and listen for murmurs again in the tricuspid valve. Good. I didn't hear any murmurs.
Okay.
Now I'm going to move to the fifth intercostal space.
Mm-hmm.
So this was fourth intercostal space. I feel fifth and space. So it's going to be right here, and it's going to be mid-clavicular. So I'd go down to the clavicle and find right about here.
Okay.
And this is going to be your mitral valve.
Okay.
I'm going to listen with my diaphragm. Good. Normal S1, S2 sounds. I'm going to flip and listen with my bell for any murmurs. Good. I don't hear any murmurs, so now I'm going to flip to my diaphragm again and listen for a full minute to your apical pulse, which is our strongest pulse on our body. Okay. Okay, great. So I listened for a full minute, and your pulse was 54.
Okay.
Okay, so that is within normal range. Okay?
All right.
So I'm going to cover you back up here,
Okay.
and I'm going to move to the abdominal portion of this exam. I'm going to keep you covered the whole time, so don't worry about that. Go ahead and pull your gown up, exposing just your stomach area. Perfect. Very good. So first I'm going to just look at the stomach, observing any abnormalities like masses, lumps, bumps. I don't see any abnormal bloating or distension of any sort.
Okay.
You don't have any diagnoses of the stomach that I should be concerned about?
No.
No cramping, bloating, diarrhea, nothing like that.
Not really.
Okay, now I'm going to move to the head of the bed and assess the same thing. Good, I'm not seeing any bloating or distension or any masses or lumps or anything like that. Now can I have you take a deep breath and hold it? Good. So I see that the aorta is pulsing, which is good. Okay. So now, for the next portion of this exam, I'm going to listen to all 4 quadrants for normal bowel sounds.
Okay.
I should hear at least 5 to 30 per minute. Okay.
Sounds good.
And I'm going to start in the right lower quadrant, listening with my diaphragm.
All right.
Okay.
Sounds good.
So I'm starting at the right lower quadrant. Good. Active bowel sounds, 5 heard. Moving to the right upper quadrant. Good. Active bowel sounds. Moving to the left upper quadrant. Good. Normal bowel sounds. And moving to the left lower quadrant. Great. I hear normal bowel sounds in all 4 quadrants.
Okay.
Now I'm going to do the same thing. I'm going to be listening to abdominal arteries and just noting any bruits of any sort.
Okay.
Okay?
Mm-hmm.
So I'm first going to start with your aortic artery.
Okay.
And I'm going to use the bell of my stethoscope to listen for any bruits, which again is obstruction in the artery. Okay? So I see your xiphoid process, and here, meet in the middle, and this is where your aortic artery is. I'm going to listen with the bell of my stethoscope. Good, I'm not hearing any swooshing, so I have no concerns about bruits. I'm now going to listen to your renal arteries, which are right about here and here. I'm going to listen to the left side first. Good, no swooshing, not concerned about bruits. I'm going to listen to this side. Good, no bruits. Now I'm going to listen to both of your iliac arteries, which are about here and here. I'm going to listen this side first. Good, no swooshing. I'm going to listen to your other side. Good. I don't hear any bruits noted throughout the entire abdominal wall, so
Okay.
I have no concerns about that. Okay, so now I'm going to percuss your stomach in all 4 quadrants, the same motion that we made from right lower quadrant to left lower quadrant. Okay? And if you have any pain or tenderness throughout this, just let me know, okay?
Sounds good.
I'm just listening for tympany throughout the stomach. Good, so I heard tympany throughout, which is a good sign. And now I'm going to do the same thing, but start in the right lower quadrant and find your liver border. And once we hit your liver border, it should be more of a dull sound because it is an organ, okay? So I'm going to start in the right lower quadrant. I should hear tympany right now. Good, and dullness heard. So I would assume your liver is right about here, okay? Now I'm going to palpate your stomach, and I'm going to start with light palpation. Just let me know again if you feel any pain or tenderness throughout this, okay? Any pain?
No pain.
Okay. Any pain or tenderness?
No pain.
Good. Any pain or tenderness?
No pain.
Great. Now I'm going to move on to deep palpation.
Okay.
Again, if you feel pain or tenderness, please let me know. Any pain or tenderness while I'm
No.
doing this?
Nope.
Great. Okay. Any pain?
Nope.
Good. Okay, so I'm finished with the abdominal assessment. I'm going to go ahead and cover you back up. Now I'm going to be assessing or feeling and listening to both of your femoral arteries, okay? And for this part, it may feel a little uncomfortable because I do have to go below the waistband.
Mm-hmm.
So if you do feel uncomfortable throughout this portion, please do let me know, okay? Is it okay if I assess your femoral arteries?
Good.
Okay, can you make a bending motion with both of your legs? That's perfect. Great, thank you. And I'm gonna keep you covered throughout the whole time. I'm gonna slip my hand right here and feel for both of your femoral arteries, femoral pulses. Good, so I feel that one, it's strong and bounding. I'm gonna feel for the other one now. Good, I feel that one, it's strong and bounding as well. Now I'm gonna check for symmetry of both pulses.
Okay.
And great, they are both symmetrical and bounding. So now I'm going to auscultate both of them, again listening for bruits, which is obstruction in the artery. Okay? I'm going to do this with the bell side of my stethoscope. Okay, again, just going to reach under here, feeling for them first. Good. And then right here. Good. And now I'm going to feel for the other side. Good. I'm going to slide my stethoscope. And then right here on the leg. Okay? And I don't hear any bruits in either one of those.
Okay.
So I have no concerns about any abnormalities as far as that goes.
Okay.
Okay?
Sounds good.
So I'm going to keep you covered up. It is okay if I uncover your legs
go
for
ahead.
this portion of the exam. Okay? Good. Place this over here. I'm first going to look at your legs. I don't see any abnormal bumps, lesions, bruises, masses of anything of that sort. Have you had any surgical procedures on your knees?
No
Any pain in
surgical.
your legs?
Nothing.
Great. So I'm going to feel for muscle tone. Just feeling throughout the legs. Any pain or tenderness throughout?
Nothing.
No? Okay. Is it okay if I take your socks off?
Yep.
Okay, very good. I'm going to note for edema throughout the legs real quick.
Okay.
I'm just going to do this by pressing down on your skin. I don't see any pitting edema throughout the legs, so I have no concerns of fluid overload or anything of that sort.
Sounds good.
Okay, I'm going to go down to your toes. Looking at your feet, I don't see any abnormalities. They feel a normal temperature. They're not overly cold or anything like that. I'm going to check your cap refill in all of your toes, making sure that it's under 3 seconds. And it is in all of your toes, so I have no concerns about perfusion or anything of that sort. Okay? Now I'm going to feel for all of your pulses and your legs. Can you go ahead and bend your legs for me? Good. I'm going to feel for your popliteal pulses first. Okay, good. They're both strong and symmetrical. Great. Now I'm going to go down to your feet. I'm going to feel for your posterior tibialis pulses, which are on either sides of your ankles. Feel for one. Good. Now I'm going to feel for the other. Good. So they're both very strong and symmetrical. I have no concerns about that. Okay. Now I'm going to feel for your dorsalis pedis pulses. Good. So they're both strong and symmetrical. So I have no concerns with that. Okay?
Sounds good.
The next test I'm going to perform is a sharp and dull test throughout your legs.
Okay.
This is just making sure that all the sensory in your legs is as normal. If it wasn't, I would be concerned about neuropathy or anything of that sort. You've never been diagnosed with neuropathy or anything like that?
Nope, got feeling it all over.
Great. Okay. So I'm going to take my instrument here, and I'm going to tell you the difference between sharp and dull. I'm going to have you close your eyes and just tell me where I am throughout the legs. But first, this is a sharp feeling, okay? And this is a dull.
Got it.
Okay? You know the difference?
Yes, ma'am.
Okay, go ahead and close your eyes and tell me where I am throughout the legs.
Sharp left thigh.
Very good.
Dull right thigh. Dull right shin. Sharp left shin. Dull right under the foot. Dull left under the foot. Dull left top of the foot.
Very good. Okay. So I have no concerns about sensory throughout the entire legs. You did a great job with the assessment, so I have no other concerns with that. Okay, so I'm going to cover you up here, and I'm going to have you swing around, and go ahead and just sit down for me. Your legs hanging off the bed. Great. I'm going to tie you up back here. Is that okay?
Yep, go for it.
And I have one more down here. Sorry to reach over you.
You're okay.
Okay, so I am going to just do some range of motion exercises with your legs, make sure everything is working normal, and I'm going to also test the strength of your legs, okay? So I'm going to place my hands on your either side of your legs. Don't let me push out. Good. And now I'm going to do it on the outside. Don't let me push in. Good. Perfect. Now I'm going to have your feet here. Go ahead and don't let me push up. Good. And don't let me push down. Good. And don't let me push in. Good. And don't let me push in again. Good. So I can tell that all of your strength throughout your legs is doing good. Okay.
Okay.
And they all look normal. Okay. So the next thing I'm going to do is going to have you kick both of your legs up. I'm just feeling for your strength and range of motion here. Good. And good. I don't feel any creaking or cracking of any sort. The next thing I'm going to do is test your patellar function, just making sure that you can kick your legs out.
Okay.
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 Go ahead and close your eyes.
Reflexes.
Yep. So I'm going to test your patellar reflex function. Okay. Good. I'm going to do that one more time. Good. So that one was a little bit more minimal, but it still had a reflex, so I'm not concerned about anything of that sort.
Okay.
Okay, very good. Now the last thing I want you to do is go ahead and roll your ankles for me. Good. No creaking or cracking of that sort. So I feel good. Moving on to the next part of the assessment.
Okay.
Your muscle tone is good, your strength is good, and your range of motion is good. Before I stand you up and do the next part of my assessment, do you have any concerns with falls or anything like that?
No falls.
No falls.
Pretty steady on my feet.
Okay,
Don't
good.
get dizzy.
And you don't get dizzy when you stand up.
Oh, man.
Very good. Okay. I'm going to put your socks and shoes on before we stand up.
Go for it.
The next thing I'm going to assess is just your gait and your balance. We're going to do a Romberg's test on you when I stand you up, which is just making sure that I can move forward with the next part of the exam. Make sure that you're not going to fall or anything like that.
Mm-hmm.
Okay? Get your socks and shoes on here. Sorry.
No, you're okay. Shoes are pain. There we go.
Okay, a little more. Let you slip your foot in there.
Okay.
Good, I'm gonna tie you up real quick just for extra precaution.
That's probably a good idea.
Yep.
Pretty tight shoes though. Thank you.
You're welcome.
Thank you.
Okay. Alright, so go ahead and stand up for me and face this way. I'm going to have you close your eyes. I'm going to note for any swing of any sort. This is testing cranial nerve number 8, which is acoustic. Good, I'm not seeing any swing, so you have a negative Romberg's test.
Good.
So I'm going
Sweet.
to have you just take a few steps forward. I'm going to test your gait. Very good. Now turn around. Very good. And now on the way back, I'm going to have you do a heel to toe test, just putting one foot in front of the other. Very good. Okay. You did awesome with that.
Awesome.
So
right.
I would rate you a 23 on the burden scale.
Okay.
Because you have great mobility. You get normal physical activity every day. You don't have any friction or shearing, extra precautions like that. Your nutrition is great.
Okay.
And you don't have any issues making it to the bathroom, so I would say that you're not incontinent.
Okay.
Okay? So thank you for letting me perform this head to toe on you. I hope you have a great day.
Oh, thank you.
You're welcome.
Yep.
Thank you.